Welcome to another video here. Today we're going to go through how YouTube recently updated some of their COVID-19 misinformation policies. They did this fairly quietly. Not a lot of people have spoken about this. I think there are some interesting aspects to this to look at, and perhaps some moments where things might feel a little bit frustrating because a lot of the things that have been removed are things that people have been showing very clearly that there hasn't been much certainty on yet. YouTube and World Health Organization and so on and so forth have been claiming a great deal of certainty about. So just to keep in mind that YouTube developed these policies back in May of 2020. It appears as though they were written with the help of the World Health Organization or the CDC. I have no way of proving that, but the way a lot of the policy is written, it's very, very specific. It points to things that people have to have quite a bit of knowledge on in terms of all the things that are potentially connected to COVID-19. So somebody seems to have written this with YouTube. World Health Organization in general has been where the YouTube has been, pushing their authority to. So their guidance is coming from World Health Organization. Any video that goes against what they're saying is not going to be accepted on the platform. Keep in mind, the World Health Organization is a political entity. It's not as though it's just purely a medical organization that's trying to help the world per se. It is a political entity with its own political agendas. So that's important to keep in mind as we go through some of this. Now, the first thing, when we go to this COVID-19 medical misinformation policy, this is the existing one. You'll see that there are 5 bullet points: treatment, prevention, diagnosis, transmission, and the existence of COVID-19. Now, what I'm going to be doing is going to the Wayback Machine. This is the Internet Archive, and pulling the old version of this. So if you want to compare, there'll be links in the description as to how you can compare this yourself. But you'll notice right off the top when we go to the archive here that it used to say, in one of these bullet points, social distancing and self-isolation guidelines. So YouTube has removed this particular bullet point, basically stating that this is no longer something that we're going to be tackling misinformation about. What it used to say in the archive here, throughout the list of things that they were going to go after, was social distancing and self-isolation misinformation, content that disputes the efficacy of local health authorities or WHO's guidance on physical distancing or self-isolation measures to reduce transmission of COVID-19. So what this is essentially saying is, back just a few weeks ago, if you made a video saying that, social distancing, hey, it may not be all that it's cracked out to be. Here are some studies, here's some stuff that some doctors are saying, some scientists might be saying that, hey, social distancing probably doesn't reduce the transmission of COVID-19. You would have had that removed, or at least it was able to be removed under YouTube's policies. But now they're saying, nope, that's totally fine. You can go on saying that. And another bullet point here within a list that has been removed regards to social distancing is videos alleging that social distancing and self-isolation are not effective in reducing the spread of the virus. So again, here, they're basically saying that this is now on the table. You can talk about this if you like. I'm not sure if they're going to make the argument that, well, Omicron is just so contagious that no matter what, something's going to happen, or, whether they're kind of admitting that these practices probably were not working from the very beginning. But you know what? That's up for us to decide. So a few other things that have been removed here with regards to masks. So we can see 2 bullet points here from the past that are no longer existing on the policy today. Claims that wearing a mask is dangerous or causes negative physical effects. And then also claims that masks do not play a role in preventing the contraction or transmission of COVID-19. So those have both been removed. So now apparently you can come on YouTube and talk about how masks may not be effective in preventing the transmission of COVID-19, and that masks may have negative physical effects. Again, why was this not okay to talk about in the past when it seemed fairly commonsensical? Now, again, I know some people are going to make the argument that, hey, you know what? We were doing our best. We were just trying to make sure that people were following whatever could potentially reduce the risk of COVID-19 because it was such a massive crisis, right? This might be an argument that people make. Off the top, I think that the vast majority of us within the public. I mean, not maybe people who've been looking at a lot of alternative sources, but the vast majority of us have been misinformed about the true dangers of COVID-19 and actually putting that into context. I mean, this has been seen time and time again when studies have been done looking at, or surveys in particular, looking at people's estimation of the dangers of hospitalization. What is the risk of hospitalization from COVID-19? People were wildly misinformed of what the rate of hospitalization actually is, whether you're vaccinated or unvaccinated. We know that number is less than 1%. So if you're infected with COVID-19, you have a less than 1% chance of ending up in hospital, whether you're vaccinated or not. Yet you have, large swaths of people walking around out there thinking that, the rate is 30, 40, 50%, so on and so forth. This represents a massive misrepresentation and contextualization of how dangerous COVID-19 was. So when then people come and say, well, you know what, we were just trying to do whatever we could to reduce the risk, that's coming from a misinformed foundation to begin with. So the idea here that they're suddenly just removing this discussion of masks, you're allowed to talk about it now. I mean, at the end of the day, did they kill a bunch of people by having them wear masks? No, probably not. But people were doing things, scientists and doctors were coming forward saying, you know what, I don't know that this is a policy that we absolutely need. Let's just leave it optional for people. Allow people to have the option to wear it if they want. That would have been probably the right thing to do. I think we're now seeing that YouTube and World Health Organization probably acknowledges that, which is why a lot of this stuff's being removed. But that's, again, I'm just leaving it out there. So also they removed claims that wearing a mask causes oxygen levels to drop to dangerous levels, claims that masks cause lung cancer or brain damage, claims that wearing a mask gives you COVID-19. Now, obviously the bottom two there, probably not the greatest of claims to be being made out there in general, but oxygen levels dropping. I mean, we did see some interesting studies of oxygen levels dropping in these particular cases. Again, how many people is this going to affect? What really are we talking about here? We're talking about long-term mask wearing. There have been multiple studies looking at the effects of long-term mask wearing on different portions of the population, different professions. We actually put up an article, I believe it was back in 2021, about this, looking at a study, and it did show that there was a lot of negative effects. And now apparently we're allowed to talk about that here on YouTube, even though it's kind of too late, and the people who might have wanted to know about those negative effects that were documented can't look at those negative effects when it mattered. So, again, this is interesting stuff here when you really consider it in the big picture. So another big thing that was removed here was claims that COVID-19 vaccines are not effective in preventing the spread of COVID-19. So rewind here, there was a lot of data that came out of Israel at the time. There were some data that was coming out of a few other countries that had good, like the UK, for example, had great data that was coming in, that was being collected properly, that was really being analyzed properly, high quality data, you might say. And there was stories coming out. You could see that, hey, you know what? This vaccine wanes in efficacy. It doesn't seem to have the ability to really reduce transmission all that well. It doesn't prevent it, that's for sure. So there might be a mild reduction of transmission for a short period of time, but in terms of preventing transmission, that doesn't happen, right? And we knew that. We've probably known that for a year and a half or so. And yet, here we are, YouTube has held it there where you weren't allowed to go on YouTube and say that. And we ourselves had a video removed as a result of that here on The Pulse. And yet now all of a sudden, you're allowed to go on and say that COVID vaccines are not effective in preventing the spread of COVID-19, because the truth is that they're not effective in doing that in any way, shape, or form. And again, we've known that for a very long time. So again, YouTube here is actually following the science for the first time. You would say that they weren't following the science prior to this, but that was the claim that they were making, that they were just following the science. So that's a big change. A little bit contradictory, though, is that if you were to come over to another part of their policy, which is vaccine misinformation policy. So this is not COVID-19 medical misinformation. This is vaccine misinformation policy. You have a bit of a contradiction now, because you're now seeing that when it comes to efficacy of vaccines, content claiming that vaccines do not reduce transmission or contraction of a disease. could now be considered medical misinformation. So they're talking about vaccines as a whole. They're not just talking about COVID-19. But because this policy exists, it leaves this gray area where if you now come out and say that, COVID-19 vaccines are not necessarily preventing transmission, they could, under this policy, just remove your content. So that could just be an oversight on their part. I really have no idea. Another interesting piece here is vaccine safety. This is in the vaccine misinformation policy as well. Content alleging that vaccines cause chronic side effects outside of rare side effects that are recognized by health authorities. So you're still not really able to talk about that. But again, what's fascinating about this is that there's a lot of evolving information when it comes to COVID-19 vaccines and potential side effects, how widespread they are. There's been a lot of discussion from some people wondering whether or not it's having an effect on cancers or other diseases and stuff like that. And, YouTube is still saying you're not allowed to talk about that. Could down the road, when it becomes a little bit potentially more obvious what exactly is happening with chronic illnesses related to COVID-19 vaccines, would YouTube change that? Well, yeah, but would it be too late at that point? Yes. So my issue here, and you're seeing this in both the masking discussion as well as potentially what we're going to see with chronic illnesses, is that YouTube is following this political guidance of the World Health Organization to create their policies, but they're not allowing an open and honest conversation. And thus, it might actually be too late for the people that it matters for to have heard the thing that might have helped them down the road. YouTube will remove these policies when it doesn't matter, is essentially what I'm saying. And, we've heard over and over and over again when it comes to COVID-19 that nobody's really an expert on this particular subject because it's so new, right? We have a novel virus that nobody knew about. We have no experts. We don't know what it's going to do. We don't know what effect it's going to have on the population, right? This is what we were told over and over and over by the mainstream. So why then is a single organization being put as the expert of this particular virus? It doesn't make any sense. It's another sort of paradoxical contradiction that has been happening in the narrative for a long time. It's important in times like this, if you were to follow the mainstream narrative, right? Now we're following that narrative. It's a new virus. It's a novel virus. Wouldn't you want as many potential voices that are qualified to speak to talk about this, right? Wouldn't you want doctors and scientists who are extremely well respected in the field of epidemiology or virology to talk about this and to be able to address, hey, here's what we're seeing, here's what we think is going on, so on and so forth. Here's where we have certainty, here's where we don't have certainty. Of course you would, but instead policies are saying, no, World Health Organization is the only one that's allowed to say anything. So this is partly why we got into this mess, is we got tunnel vision towards who the experts were, never really questioning why they were considered the experts. And, of course, we've seen all of the mistakes that have happened over the course of COVID-19. Remember when, the lab leak was, no, absolutely impossible, cannot, because Fauci and the CDC and the NIH said, no, that's impossible. Conflict of interest there. Obviously, all of them would be implicated in this. Therefore, now all of a sudden, I think it was about a year later, it was okay to talk about the lab leak, right? And it's in all of this. It's in this mess that we're seeing why, you hear this issue. I was just going through some FOIA documents that we got from here in Canada. We got from CSIS, and it was talking about how there's all these conspiracy theories online. There's such a lack of trust in government. There's such a lack of trust in authorities out there, and this is the advice the intelligence agencies here in Canada are giving to government about the nature of how much there's just no trust. And it's like, well, do you ever consider that the World Health Organization and YouTube's policies, like this example that we're just providing here, could be, sowing the mistrust? Like people have been saying for so long, hey, you know what? I don't know if we should be so certain about masks. I don't know if we should destroy people's businesses, destroy their YouTube channels, destroy their media outlets, destroy, everything that they've built, right? Like we've built our company for years and years and years. Quote unquote misinformation has cost us tons of money over the course of time. It's cost us platforms, right? People have this lack of trust because the mainstream has been claiming a sense of certainty over a number of different topics where they could not possibly have certainty. And I think this is a very, very important thing that not only should be a critique of the mainstream, but also should really be a critique of some of the independent media. Because, and I've said this a lot, and I'm saying this again because, I really think it's important that we consider the impeccability of our word and the impeccability of what we're saying, right? If we're going to go out there, we're always going to create hyperbolic statements that, oh my God, these vaccines are killing everybody. And oh my God, the mainstream is just always wrong every single time, 100% of the time. It's not true, right? It's not accurate. It's hyperbolic statements that suggest that we're kind of just wanting to say whatever we believe and whatever is a certainty that we hold within our belief system. Whereas I think the better way forward is to be specific, is to be nuanced, is to be accurate, is to admit to uncertainty where we don't know or where we don't know what is certain. If we're asking this from the mainstream, we also have to ask it from alternative platforms and alternative communities that are trying to navigate this information themselves. We have to stay open. We have to be able to bring a conversation to the table that is grounded and that is truly seeking truth, not just saying, well, this is always a disaster. This is always going to be like this. Or because they were wrong once, they're wrong every single time. These things are easy to poke holes in. These things are easy to debunk. And once you start having this culture war of, debunking what you have to say and debunking blah, 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 then it ends and nobody wants to talk, right? Whereas we need people talking. So we have to consider, are we being impeccable with our word when we make comments, when we share things with other people, when we have conversations? Are we claiming to be more right than we could actually possibly be, right? These are things I think we have to consider, and that's kind of how I wanted to cap this off. Again, interesting updates from YouTube here at the end of the day. I mean, it kind of confirms a lot of stuff that people had been asking questions about for a long time. But at the same time, let's not be potentially YouTube and the mainstream on the other side by pretending we're a lot more certain about things than we actually are. But that's it. That's all. Thanks so much for watching. Be sure to subscribe, pass this video on to somebody else, and we'll catch you next time.